So the pharmacist has a really difficult choice. They've got a patient in front of them. They have the drug in stock, and they have to choose: am I going to take care of my patient, or am I going to send them away
Hmm.
because their PBM doesn't want to pay me today for this medication?
Hey everyone, it's been a little while since our last release of the podcast, and that's because I've been working on something that I think is kind of special. I've been lining up guests for this next series, which is our CEO series. Basically, what I'm going to do is sit down with CEOs around Central Florida and just talk shop. Talk to them about their specific business, the industry they're in, the hurdles that they're trying to jump over, the waters are navigating. All the good, the bad, and the ugly, and I think it's going to be really fun. So here's the first of probably 10 or 12 that we've got in line over the next few months, and I hope you enjoy. All right, welcome back to Exploring Growth. Today we have what I would consider a unique guest and our first in the CEO series that we're kicking off here for 2024. Jesse Brashear with Brashear's Pharmacy over in Inverness, Florida. Welcome, Jesse.
Hi, Lee. Welcome. Thank you, or thank you for having me.
Sure. Yeah. I'm excited to talk to you. I love learning about businesses that aren't necessarily in the mainstream. There's a lot of businesses that don't really get the spotlight on, the successes that they're having and the things that they're doing. They're not, I would call maybe not as sexy as other tech or AI or whatever people are talking about these days. So I'm excited to have you on, learn a little bit about how you approach growth for the pharmacy, and honestly, just learn a little bit about how the business of pharmacy goes. So maybe that's probably a good place to start. Just what I would call a crash course for how the pharmacy business works.
Yeah, absolutely. So the business of pharmacy in today's world is very different than it was 20 years ago or even 30 years ago, as anybody might imagine, with changes in how the internet has changed things. Um, it's So I'm a second generation pharmacy owner. I
Okay.
come from a line of pharmacists. My dad's a pharmacist. I've got two uncles that were pharmacists.
Nice.
All three of them are now retired. I work with a cousin who is a pharmacist
Okay. So it's all in the
every day.
family.
Yeah,
Yeah.
it's my wife is a pharmacist. It's an absolute
Wow.
joy to
Okay.
work with her every day, side by side. But the how pharmacy operates is that when a patient gets their prescription and brings it into the pharmacy, 9 times out of 10, the patients uh, today have some sort of prescription benefit.
Okay.
And between their insurance company and the pharmacy, there's middlemen called pharmacy benefit managers.
Okay.
And those PBMs were initially designed 30, 40 years ago to be claims processors. The pharmacy would buy a drug, generally either from the manufacturer or from a wholesaler, and they'd put a markup on that, adjudicate the claim, send it through the PBM, and the PBM would issue a check from the pharmacy. So that's kind of how um, PBMs were originally designed to work with pharmacies.
Okay.
What we're finding now, and what has actually become a huge burden on the industry of pharmacy, not just independent pharmacies like mine, but large regional chains, drugstores that you've heard of, like Rite
Hmm.
Aid, even Walgreens on occasion. Um, a pharmacy can buy a drug, put a markup on it, and the PBM will say, well, we're not going to reimburse you that price. We're going to reimburse you this price. And it could even be less than the acquisition cost of that drug. So the pharmacist has a really difficult choice. They've got a patient in front of them. They have the drug in stock, and they have to choose: am I going to take care of my patient, or am I going to send them away
Hmm.
because their PBM doesn't want to pay me today for this medication? And
Right.
it's a huge problem. It's closing pharmacies all over the country. In my own county here in Central Florida, we've had 5 pharmacies that closed in the fourth quarter of 2023,
Hmm.
chain drugstores and independents. So, um,
That's
it's a,
crazy.
yeah,
Yeah. So, I mean, just to back up a step for the people like myself in the audience, you're buying pharmaceuticals from pharmaceutical companies, I assume, and then and those are your suppliers, right? To make it, the language the same across other businesses, and those pharmaceuticals come in, and then you resell those at theoretically an additional rate. But then that's where the problem really comes in. Is that what you're explaining?
Yeah, the pharmacy industry is broken right now. That
Okay.
the price of a drug that pharmacies can buy from their suppliers,
Mhm.
very often throughout the day, they can be reimbursed by PBMs lower than the acquisition cost of that drug. Um, and so pharmacists are in this unique situation of having to choose between taking care of their patients or taking care of their own families and putting
Mhm.
food on the table.
Yeah. Can you give me an example? I mean, I know you can't use names or anything like that, but give me an example that would help us to illustrate this for the audience where, if you had a specific type of case where someone comes in about a certain drug and they weren't able to get it or you weren't able to give it, I guess it's such a dicey situation.
Yeah, absolutely. Just a couple of weeks ago, we've had a patient that has been coming into one of our pharmacies for about 2 years now. He gets a medication to control um, antipsychotic behavior, for lack
Okay.
of a better term. And our pharmacists are certified to administer that medication in the pharmacy. It's not one that the patient injects themselves. It needs a nurse or a pharmacist or a doctor to administer, and our
Okay.
pharmacist went and got special training to do that. We've been taking care of this patient for years, but in January, when we submitted that claim to his PBM, they were going to pay us $100 less than it cost us to buy it.
Mm.
So this is a drug that took increased effort to dispense. It took more pharmacist time to dispense.
Mhm.
It was an expensive drug already, costing $1,500 a month. And in this situation, we had to call that patient who we knew and cared about.
Yeah.
He was successfully being treated with this drug, um, and had to say he had to go to another pharmacy. It was beyond our control in that situation.
That's tough. I mean, it goes beyond another type of business where you can say, "Hey, sorry, we're out of that product," to, "Hey, we've been caring for this patient for months or even a lot of times probably years, and now we have to say no to a person who their well-being is attached to this product." I can't imagine having to do that. I mean, I'm in the business of marketing and video and consulting and stuff like that. We're not curing cancer over here. We're just making people feel good and hopefully compelling them to make a decision, that's different than another one. So I can't imagine having to turn away somebody. And if you were to turn or probably in that case, you had to turn that person away, where would they go? Where would they go to get that drug if they can't get it from you?
So the patient initially tried to go to another independent pharmacy that was in another town nearby, about 30-minute drive, that also has pharmacists that are trained and willing to administer that kind of
Hmm.
drug. Um, and that pharmacy called us, transferred the prescription, and when they also adjudicated that claim and sent it to the PBM, they also realized, oh, I would be losing money on this as well.
Yeah.
I can't dispense this.
Right.
So the patient's family called us back saying, what do we do? And so we said, um, take it to a chain and then bring it to us. And we worked out a price where they could still pay us to administer it
Hmm.
to them. And so in that case, it was an inconvenience to the patient,
Hmm.
but we did the best we could in a bad situation.
Yeah, that's tough. That's tough
Hmm.
that it really gets put on the patient to
Hmm.
have to decide. And in some cases, I've heard in the past too, talking about type 1 diabetics where they have insulin shortage or some kind of specific drug that they have to have, where, their actual, their physical health is put on pause, until they can work it out. And so their whole life really is on pause until they can get that next, um, delivery of whatever that drug is. So that's got to be such a tough hurdle as a business owner, to be so, for lack of a better word, enmeshed with your patients and really truly caring for them and then being kind of handcuffed, to not be able to care for them. I mean, I can imagine that's produces such a hurdle in trying to grow your pharmacy because it's almost like you are pulling behind you have this weight that you're pulling behind you that continues to grow while you're trying to run faster into the headwind that you're running into. Man, it seems like it's a hurdle that's almost um, insurmountable.
It does feel insurmountable, Lee, and yet we've committed to try and see this through. Our industry is changing. We are, as a business, as a corporation, we are trying to do everything that we can to get to the other side of this. We
Hmm.
advocate legislatively. I was heavily involved in state legislative efforts in 2023 in Tallahassee, trying to get some relief, get some control back for our patients with with success.
Hmm.
Um, but it feels like a little, too late.
Sure.
So even with what we hoped would be, wildly successful, pharmacies are still closing. And that's not, and if all that does is put more grief, more difficulty on patients, it
Hmm.
provides more patients to fewer pharmacies. And you think in most businesses, growth would be, or, new patients would be an avenue to growth.
That's right.
And in pharmacy, which restaurant doesn't want to see new customers walking in their door every night?
That's right.
However, in pharmacy, volume does not necessarily lead to financial growth. Volume could, you've got to have the right mix of patients
Hmm.
and payers and drugs to remain viable as a pharmacy business in 2024.
Yeah, I'm sitting here thinking, I wonder if this problem is kind of blanket across the board, where you're experiencing probably decreases in payouts from all pharmaceuticals, or is this really dedicated, or are you seeing this in specific drugs?
It's specific drugs and
Okay.
it's specific plans on specific drugs.
Okay.
So you could take an insulin, for example, and you could have the same drug that you submit to four different payers,
Hmm.
PBMs, and each one of you're buying it from your supplier at the same price. But each of those payers could be reimbursing a different price back to you. Some may be paying you above cost that you can afford to dispense that medication, and some could be paying you under cost,
Right.
sometimes wildly under cost, in which case you've got to then be able to go and do the analytics to say, can I
Hmm.
afford to still dispense this drug to the patient? Are there other drugs that this patient is taking that maybe offset this loss? Because pharmacists don't
Hmm.
ever want to send away a patient.
That's right.
Pharmacists want to care for that patient. That's what they're trained to do. They're experts on it. Pharmacists, Lee, have doctorates
Hmm.
in pharmacy. They are the experts on how drugs work in the body,
Right.
and drugs only work in patients that take them, and so they
That's
don't
right.
ever want to have to send a patient away. So we desperately try and look at the whole patient to see if we can keep them before having to send somebody away. We never want to do that, but unfortunately, in our industry today, it has to happen.
Yeah, I can appreciate that. I what I want to do is pause for a minute and come back to this conversation. I really am interested in knowing, what's your thought process and your mindset around trying to grow through this. But before we do that, I want to go back to however many years ago it was before all of this kind of madness started in your industry.
Mhm.
How long ago was that when things were sort of normal? And during that time, what did you do to grow your pharmacy?
Okay. So I've been working in the pharmacy industry for 20 years, right out
Mm.
of college. And when I started in pharmacy, um, about 90% of patients did not have any drug coverage for their prescriptions, and 10% did.
Okay.
Um, and so back then, to grow your business, you marketed, you got out in the community,
Hmm.
um, and tried to bring in, like most businesses, as much volume as you could possibly attract
Hmm.
to your pharmacy. And then you work to be very competitive on price locally. You research what other pharmacies were charging for drugs. You anticipated. You created certain schedules of um, drug pricing where, hey, I know this is a top mover. We're going to dispense this drug all day long. We want to be really competitive on this drug.
Hmm.
So we'll market with kind of a smaller markup because we know we're going to sell a lot of it. And that made sense. That worked. The 10% of patients at the time that did have drug coverage, that was not any trouble. We could handle
Hmm.
both. Um, and over the years, actually in 2005 is when Medicare Part D started. That was a proposal by President George W. Bush to help seniors with their drug coverage on Medicare. And over the last 20 years, that has changed so that now, in today's world, only about 10%, it's flipped. Only about 10% of people don't have some sort of drug coverage. Um, so back in the day, we were able to just attract patients the normal way that you would. You would reach out to their doctors. You'd have good relationships with physicians' offices, so that if they had a problem, they would call you. They might even
Okay.
refer a patient to you.
Hmm.
You put advertisements in your local newspaper. The idea of advertising on social media wasn't even a thing back then. Um,
That's right.
yeah,
Yeah, well, that's good too because we have a broad audience here of business owners and leaders that are in multiple different types of industries and services. So I think pulling out one tactic that you did that worked in the past is helpful for them today because they're not in the highly tumultuous industry that you're in currently.
yeah,
And I think the one thing I would pull out of that is that you would reach out to these doctors and form relationships, to inform those conversations and have an actual line of communication. So reaching out to what other people might call partnerships or strategic partners that are also talking to your customers is a great avenue for building relationships that they give gifts for a long time. You build that one relationship and that is going to help you for a long period of time. Okay, that's a great picture. I appreciate that because it shows that there was a time that it was normal, and you probably never foresaw this issue of how do we actually just care for a patient. So let's go back to our other conversation now that we were talking about this issue that you're currently in and you're hopeful that it's going to resolve on various levels. How are you approaching growth now? How are you thinking about, I know you mentioned trying to be strategic and look at the whole picture. um, I think there are a lot of people that are listening that are in businesses that are having issues in their industry, regulatory. I've talked to lots of businesses that are highly regulated, and they are constantly having to, look around the red tape and figure out what the red tape even says. So I'm curious to know how you're trying to grow through this.
yeah. So the pharmacy industry today still has multiple avenues available to them for growth. We still are active on social media marketing. That has been really helpful to us. In the last year and a half, we've got a great following in the various social media channels. And
Okay.
we work with an outside agency that helps us with that. I outsource that to try and take that and grow that to the next level beyond what I had
Yeah,
been doing as a
that's
business
great.
owner. Um, just like any business owner, you can't do everything. You're not going to be good at everything.
Hmm.
For us, it made sense to hire somebody outside and outsource that.
Sure.
Um, we still bring, so our goal is still to bring in patients every day, new
Hmm.
patients. But then we have to be more strategic with who we're actually going to, not
Hmm.
every patient is a good fit.
Right.
Not every patient or not every customer is a good fit for a business. And so we've got to find ones that make sense for us and who have um, payers and
Hmm.
prescriptions that make sense for us to dispense. The regulatory part of this decision is also pretty difficult. Um, on the federal level, there are federal agencies that have seen issues in our industry, not with Brashear's pharmacy, but with pharmacy as a whole, where in our country now you've probably heard about that there's an opioid crisis.
Hmm.
Well, in the past, some chain drugstores were dispensing way more opioids than they had any reason to do, and so because of when the federal government tries to make changes, they do so in a wholesale way and affect everybody. So even sorts of certain controlled substances that were normal for us as a pharmacy to dispense, the federal government has seen fit to lower our ratios of what we can dispense. So which all just makes life harder on patients that are
That's right.
legitimate and that we need those medications. Um,
So you sort of get hemmed in on all sides.
oh yeah,
I mean, the market itself with the payers and the government then regulating more, swiftly. That can be a lot to manage at the same time.
it is a lot to manage, and I feel especially hard on, or I feel especially soft towards pharmacy owners that have one store, because one store, one pharmacy, one business location in our industry makes it very difficult to have enough staff that you can look at all this data, that you can look at these analytics, that you can have time to manage your social media and attract new business.
Hmm.
We were able to grow years ago to 2 locations, and that has been very helpful to see us through these changes nowadays. Um, we've tried to grow again. We've tried to look for right opportunities to add new stores to our business about 4 or 5 years ago, and couldn't find the right deal at the right
Hmm.
time. And I talked to a pharmacy owner just yesterday that was looking at selling and asked if we would buy it. And because of changes in our industry that are ongoing right now, I didn't think that was a safe business decision. So
Hmm.
um, I know that all of business is hard because it's personal to me. Pharmacy feels more difficult than some, with all the different ways that it's being attacked. And yet it's been good to our family. It's been good to, we feel like if Brashear's Pharmacy wasn't here, we want to be the kind of business that if Brashear's Pharmacy isn't here, people would notice that we're not here
Hmm.
anymore and that there would be something missing. Um, and I think that's a way that being able to market ourselves in that way also helps us grow, that people want to join us and be a part of what we're doing here.
Sure, I could see that. You've talked a lot about organic growth by using marketing. Have you considered looking at any type of strategic investment outside investment groups or partnerships for as a means to growth?
Yes, we have tried without much success, but have certainly made several overtures to partner with local hospitals to
Hmm.
help patients transition home. Um, for a year, we had a really highly skilled employee working in one local hospital helping patients get bedside delivery. We thought that would be of great benefit to the patient, and we thought
Hmm.
it'd be great benefit to the hospital, um, and might help us attract new customers. Um, and unfortunately, because of the changes that were still going on in the hospital industry, with nurses leaving in droves, with nurses
Hmm.
always pursuing the next highest paying position and not having a lot of stability with their employees,
Turnover.
turnover, we never could get to the right. Um, we never could get to the right gatekeepers in on each
Yeah,
hospital floor. We are
that
always
makes
having to
sense.
constantly inform them, reteach them that we were there every day, that we were available, that we could help in this way. And after a year, we just had to kind of cut our losses. It wasn't growing the way we wanted it to. So we've
Sure.
always looked for new ways to grow. 10 years ago, we bought equipment to help us provide a new level of service for patients, to help them stay out of nursing homes. It would organize their medications by day and time of day that they needed to take it. That continues to have great success in patients' lives that we
Okay.
really enjoy seeing. When
So
you
is
can,
that like a countertop type of dispensary, or how does that work?
so I know what you're talking about with the countertop. This is, we dispense it in a little box about the size of a paperback, large paperback book, large hardback book,
Okay.
and it comes off in little strips that they can just tear off every throughout the day when they need their medications.
Okay.
But they don't have to fumble around with pills. They don't have to
Mhm.
remember, hey, did I take this or
Yeah.
not?
Yeah.
So it organizes that for them. That's been a great help us
Yeah, I
grow.
love that.
Yeah.
That's really good. So it seems like you're really listening to your customers about, how they are uh, utilizing the product essentially, how it's affecting them in their lives. I'm sure that just the nature of your business, you probably hear more than you want to hear across the counter about their lives and the things that it's affecting. But listening though is your job too, is, you know, how do we take these insights and the feedback they're giving us and turn them into something that's more valuable for them? It seems like you're doing that.
Yeah, one of the things that I've always tried to do, Lee, is not silo myself. We're an independent pharmacy, but I work very hard to network with other pharmacy owners like myself to
Hmm.
learn best practices. I attend a trade show every year, not because a trade show not because the trade show presentations are all that good. Very often, it's the same presentation you heard the year before.
Yeah.
But the chance to network with other people in our industry and learn what they're doing well, what's not working for them, who's come up with a new idea that others can put to use. That's something that every business owner should be doing. Just is getting out of your business and talking to other people in your industry and
Hmm.
learning what works best.
Yes, for sure. That applies across the board. Are you so trade shows, exhibitions, conferences? I'm sure. Um, are you part of any type of co-op or organization, an association of sorts, where you can sit across like-minded pharmacists and talk about your business?
Yeah, some of that happens at those trade shows.
Okay.
And a lot of it happens on Facebook and in Facebook
Oh,
groups
right.
for our
Okay.
industry.
Makes
So
perfect sense.
that's
Yeah.
really productive for
Yeah.
me and for others. I think you can ask questions, give answers, help other people, encourage them,
Hmm.
equip them, teach them. Very often I've been doing this now 20 years. And so
Hmm.
I've seen a lot of things that others that have just been doing this a few years just haven't seen yet. And so
Right.
it's fun for me to be able to go and take my knowledge base and share it with someone else. Kind of like engaging on this podcast.
Sure.
Um,
Yeah, that's great. Well, so it sounds like you're navigating the waters and you're discerning what it is that you need to do with your business and your business model, maybe even to make it through these choppy waters. If you could look out into the future, if you had a crystal ball, do you see this changing drastically, or do you see it just being part of the new nature of the business you're in?
do I see a light at the end of the tunnel?
Right.
I have to. Yeah.
Yeah.
Um, I think there will be. I think legislatively, it's going to ultimately take. It is legislation that has caused this mess in our industry. It's going to take legislation to see a path outward
Hmm.
out of it. And I mean, some pharmacies are going to survive, some already aren't, and that's the nature of capitalism, right?
Right.
And that's okay. Sometimes in some situations, those businesses weren't set up for success. We're doing everything in our power to set our business up for success, to see
Mhm.
ourselves through to the other side, managing costs, hiring great people, um, and just trying to look to see where we can and finding the right customers with the right payers, all those things. That's what we can
Mhm.
do.
Right.
Um, we look for new services that we can provide. We look for new ways we can advertise. Um, we had this unfortunate thing that we just could not capitalize on just a few months ago, where we had a post on TikTok get 600,000 views
Okay.
within a few days. TikTok is not something that I spend a lot of time on, but my social media marketer tells me it's important.
Right.
Um, but we're a brick and mortar store. We always have been.
Yeah.
And 600,000 views on TikTok doesn't necessarily help the brick and mortar store, no
That's
matter how
right.
much I wished it would. So we learned from that maybe we need to figure something out for that the next time we go viral.
Right.
Um,
Yeah. How
so
do you
that
capitalize on that
right,
opportunity? Yeah. Right.
yeah. So that was a failure on my part that I didn't manage how to capitalize that, but
Yeah.
learning from that and getting ready for next time.
Right. Yeah, well, that's great. This has been very informative. It's helped me, have a little peek inside to the pharmacy business. I'm sure everybody's watching has gotten something from this because there's so many lessons to take from these hard, waters, these choppy waters that you're trying to navigate. Uh, all the businesses, all the people who are watching this have some hurdle that's either coming or has just passed, or they're currently jumping over it. Thanks for being so transparent and insightful about the things that you're going through. I appreciate that.
Thank you, Lee.